Hey guys, I'm going to be covering a three-part video series on the three problematic or three myths of Medicare that often seniors miss out on, and it ends up creating a lot of problems when it comes to their Medicare. Stick around, I'm going to dive into these in just a moment. I'm going to be cracking all three of these Medicare myths with you and diving into each one individually. And to get started on the Medicare myth number one, Medicare Advantage plans are not always better than original Medicare. And Medicare Advantage plans, if you understand the plans, can be very great, comprehensive care and coverage and provide needs and things like that. But the myth of Medicare Advantage plans are always better than original Medicare. So I want to explain the different parts of Medicare Part A and Part B. Some of you guys have listened to some of our other videos and me talking. I'll explain Medicare Part A and Part B, but just to break that down in a simplified version, Medicare Part A is your hospital part of coverage, and then Medicare Part B is the medical portion of Medicare coverage. And Part A has services that are going to fall under hospitalization, and there's about 7 items that fall under Part A services. And it's going to be like skilled nursing, hospice, there's items that itemize out under Part A, but there's going to be like blood and things like that that's going to incorporate in Part A. I like to give the simplified version and say anything that is attached to the hospital or happens to you during the hospital stay falls under Part A. Part B is going to be all the outpatient services like your primary care doctor, your specialist, your therapies, your diagnostics tests, labs, MRI, CAT scan, PET scans, high diagnostic services, and also there's a whole litany. So I always say inside of the hospital, you're covered under Part A. Outside of the hospital, you're covered under Part B. And that's normally the general rule of thumb. It's a simplified version if you understand how Medicare works. Part A deals with the hospital and your stay there. Part B deals with you living outside of the hospital and accessing care when it comes to the doctors, tests, lab work, and all the different things that can happen outside of a hospital care. That's going to fall under Medicare Part B. And then Medicare Advantage plans, the neat thing about Medicare Advantage plans, one is they're governed by Medicare. So Medicare has a contract with the Medicare Advantage carrier. If it's an HMO or a PPO plan or private fee-for-service or Medicare savings MSA account plans, any type of Medicare Advantage plan is going to have a contract with the federal government. And if you enroll into that health plan itself, the federal government is going to allocate a monthly allowance. And I like to just say they budget out a yearly amount that's given to the Medicare Advantage carrier. So if you enroll into Medicare Advantage Plan A, let's just say it's United Healthcare, or Medicare Advantage Plan B option, Humana, or Part C, Aetna, whatever the Medicare Advantage carrier, that doesn't really matter. The Advantage plan is contracted with the federal government. The government is going to allocate a certain pay amount regardless of what carrier you enroll into. Then it's the responsibility of that carrier to administrate all your Part A and Part B services. So if you're in a Medicare Advantage plan, by law, it's required of that plan to be equal to or better than original Medicare. So the good news is that if you're in a Medicare Advantage plan, they have to cover everything that original Part A services, hospital again. If you're in the hospital and attached to the hospital, falls under Part A services, Medicare Advantage plans have to cover that. Part B is outside of the hospital, Medicare Advantage plans have to cover that. Now, the steps to access care can be a little bit different with Medicare Advantage in comparison to a Medicare or original Medicare. Original Medicare, a lot of times people think, I have original Medicare, I can just pick the phone up, call a specialist, schedule an appointment, go see a specialist, so I can call an outpatient and go get an outpatient surgery or procedure done. And it doesn't really work that way. There are steps to procedural outcomes that you have to follow with original Medicare, and there is definitely with Medicare Advantage plans. The big difference in those is typically with a Medicare Advantage plan, they're going to drive everything through the primary care doctor, and that's just called continuity of care. The plan wants to see the doctor be involved. The Medicare Advantage plans used to have to require referrals if they're HMO. Most and almost all HMO Medicare Advantage plans now do not require a referral to go see a specialist. Now, they do have to have approval by the doctor or the plan, and typically sometimes the doctor is able to give approval if a patient needs to have a surgery, like an outpatient, or they're going to admit them to the hospital, the doctor has to approve for. So if you go to the hospital through the ER, or you're sent over to the hospital, or the doctor is looking to admit you to the hospital, typically it's the doctor making the decision, or the hospitalist doctor making the decision if it's done by ER. It's not the plan. The doctor has the power to be able to say, yes, they need to be admitted. And original Medicare, they can come in through the hospital, through ER. The hospitalist is still going to make the decision if that person needs to be admitted to the hospital. So that person can come into the ER and say, I want to be admitted to the hospital and watch for the next 3 days. I think I'm having a heart attack. And diagnostically, if they've done diagnostics and realize it's just heartburn, they're not having a heart attack, regardless of that person's desire, they're not going to admit them into the hospital. So that's with the original Medicare, and that's with Medicare Advantage plans. And a lot of times people will say, oh, Medicare Advantage plans, you have no access to care without a referral. And that's not really the case in how Medicare Advantage plans work. If you understand how the Medicare Advantage plan works, then it really eliminates the process that some people think there's a process of accessing certain care through referrals that's really not there. Historically, years ago, used to be referral based. Medicare Advantage plans, HMO and PPOs, you'd have to be referred out to a specialist. Now, typically, most of us that access care, if I'm going to go to a doctor or a specialist, I'm going to access that care through my primary care doctor because I don't know a lot of specialists. Even though I'm in the industry and we work and have referrals come in from doctors and partnerships, and I'm in the practice and own a brokerage and we specialize in Medicare health plans, well, guess what? I don't know who is the best specialist to do certain procedures or surgeries. So I would go to my primary care doctor. That doctor would say, hey, I want to send you to Dr. Bob. Dr. Bob specializes in this type of procedure. That's who I want to take a look at you and determine exactly what's going on. So that's actually what I call a handoff, or the doctor, primary care doctor, being the quarterback when it comes to calling the plays for your health. Now, obviously, you can say, I don't want to go to Dr. Bob. I've seen him 10 years ago. It was awful. They can make a different suggestion as a better bedside manner. But there is a level of systematic approach to care. That's original Medicare. If you're going to the doctor with original Medicare, you're going to access care. Typically, most people will access care the same way. You're just not going to get online and Google a specialist and just call and schedule an appointment and go. Most people don't do that. Now, can you with any of the plans, Medicare, Medicare Advantage? Yes, with Medicare Advantage, just keep in mind, you are going to require going to a doctor, going to a hospital, facility center that is part of the network. And in metro areas, you guys have heard me say this a lot of times, we live in the Middle Tennessee area. In the metro area of Nashville and abroad, around 60 miles, access to a metro area. Typically, you're not going to have issues with networks in large HMO or PPO plans. Now, in rural areas, a lot of times we tell clients you're going to have driving an hour or accessing across a state border from one state to another state to go to your doctor or hospital. We would suggest that person possibly staying on original Medicare and going to a Medicare supplement because of access to care and just the drive itself and access to quality doctors and hospitals and things like that. Being in a rural area is totally different than being in a metro area to me. That is an educational stand and kind of a mindset that I have when it comes to educating our clientele or my clientele that I've communicated with. If you're looking at a Medicare Advantage plan that work great in this scenario, if you're living in this type of environment with a rural situation, I would suggest this, and this is why. So, myth one, also just highlighting the benefits of original Medicare. One of the benefits is it does have a wider network. You're able to go outside of the state and go to a different state. If you have original Medicare and you're accessing care with a primary care doctor, a specialist, or a hospital or surgery center or a diagnostic center, you can actually go to a total different state, 6 states away, and access care as long as the doctor or the facility accepts original Medicare. So a Medicare Advantage plan, you're in the network of that plan. Now, understand, Medicare Advantage plans now have national networks. Some of them have the ability to go into another state and see doctors in that state, or if you're on a PPO plan, you can go to access care for an out-of-network cost and just know that you're going to pay a higher cost than in-network. But a lot of plans and a lot of national carriers now will have national networks, or they'll have a regional footprint of states that you can take your plan go into one of those states and not have any additional costs other than the original copay cost that you would pay to visit that doctor. So if the specialist copay is $30 and you choose to go to Florida and it's considered in network, then that would be $30 there if you went to a specialist. If a hospital surgery was $250 here for your copay portion and you go to somebody in network out of state, it's $250 there. Original Medicare is going to work by deductibles for Part A service. You're going to have a hospitalization deductible up to the first 60 days, and then beyond 60 days, 61 through 92, and then 93 and beyond, you're going to have additional copay or per cost per day cost associated with your hospital stay with original Medicare. If you're going to a doctor, you're going to pay a Part B deductible, and once that's met, you're going to pay 20% of the billable rate for all Part B services. So you can go anywhere. The network is broader in the aspect of you can access care anywhere that you want. With Medicare Advantage plan, you need to know how the benefits of the plan work. You need to make sure you're working with a licensed agent or an agency that knows what they're talking about, explaining how to access care. So one, with original Medicare, you're looking at deductibles and 20% of the billable rate, and we call that the big question mark because you really don't know what you're going to be charged and you're going to actually pay. With a Medicare Advantage plan, you typically are going to have a copay accessing care for Part B services, and you're going to know exactly the copay cost. If you ask or look at your summary of benefits or evidence of coverage, you can determine, or if you have a licensed agent or agency like us, you can call in and say, hey, I'm getting ready to go access care. I'm going to be going to another state. I want to know exactly what it's going to cost, and can I use my plan in this situation like I'm looking to do. Understanding, knowledge is power. Applying that knowledge appropriately is power for yourself to understand. So you need to make sure you're understanding exactly how things work. So another myth, dealing with this Medicare Advantage is always better than original Medicare, is just addressing the cost by mentioning Medicare supplements or Medigap that help cover out-of-pocket expenses as well. So if you're going to stay on original Medicare, you're like, hey, I'm not doing a Medicare Advantage plan. I had a family member, it was a catastrophic situation. We were always having to call, you had problems. Usually what's happened is somebody's experienced a problem. It's just like for you ladies that buy a dishwasher, if you've had a dishwasher and it broke, and you got it fixed and it broke again, and then you got it fixed and it broke again, and it was a GE product. When you go to buy another dishwasher, more than likely you're not going to buy GE anymore. You're going to say, I've had a huge amount of problem with GE, I will not buy GE. So Medicare Advantage plans is like that as well. If you've had a problem, you've seen a family or friend or somebody have major problems, sometimes you have a trigger to that to say, I'm not going on to a Medicare Advantage plan, I'm staying on original Medicare. Now my suggestion would be picking up a Medicare supplement, because that Medicare supplement is going to pick up the majority of all the costs that the Medicare, original Medicare leaves over. So the Part A deductible, the Part B deductible, and the 20%, you need to address those big question mark items of what's it going to cost me if I access care to a hospital being on original Medicare, as opposed to having original Medicare, paying for a Medicare supplement, and that supplement picks up the cost of the original Medicare, and almost 100% of the coverage is typically covered. A typical example I like to share is a Plan G. A Plan G, you only pay your Part B deductible for that year. It's typically less. Right now it's less than $300, just to kind of give you an idea in case you're watching this 2 or 3 years from now. But typically it's just it's $240 of cost deductible, and then the 20% billable rate is going to be picked up 100% by the supplement. Your Part A services for deductibles and costs, if you stay beyond 60 days in the hospital, your Medicare supplement is going to cover 100% of that cost. So eliminating the cost and the risk of what happens, or like what I like to say, the big question mark, what happens if this happens? We don't have a crystal ball in life. I wish we did. I don't, you don't, and we can't look into a crystal ball to see the future, but we can prepare properly. So the Medicare supplement is a great option for being able to pay for that. And if you're looking at Medicare supplements, we would encourage you to be able to use a brokerage like us or someone that you trust to be able to get some pricing on the supplement, determine which plan is best for you. If it's going to be a Plan G, a Plan N, if your birth date is prior to January 1st of 2020, your 65th birthday, you can actually look at a Plan F. And there's a lot of complications to moving around those different plans. There's 10 different plans, and most of the time those top two, G and N, are the options that our clients are taking, and or somebody that's a little bit older that's quoting and maybe changing their Medicare supplements can look at a plan F. We would walk you through the process of doing that. So you need to realize that you need to look at your options and understand the options. And then I want to just look at the potential downside of Advantage plans like limited provider network and prior authorization requirements. So we talked about the network a few minutes ago, and I want to talk about the prior authorization requirements. So a Medicare Advantage plan isn't always better than original Medicare. Original Medicare is going to allow the doctor to schedule a surgery and then have the surgeon do the surgery, and there's basically steps of just having it ordered and it done. With a Medicare Advantage plan, the doctor is going to get authorization from the plan. Now, typically, most Medicare Advantage plans, if it's a normal surgery and a normal procedure that doctors are doing hundreds of them a year, there's not going to be very many hoops to jump through. And also, if you watch our video on the electronic prior authorization process that's changing right now, it's changed and been passed down into CMS, and now it's coming out through the Medicare Advantage plans. There's going to be an electronic prior authorization process that eliminates a lot of the time and energy that the doctor has to spend getting the procedure authorized. You need to be educated on that properly. I'm not going to dive into that today in detail, but prior authorization is typically just a small hurdle. The doctor just authorizes the plan and lets the plan know. So I give this example. It's kind of like if you're under the age of 18, or if you're living in my home, we want to know what's happening if you're going and coming. So the smaller the child, the more kind of structure we have in place for the child. But as the child reaches the age of 18, we say, hey, if you're going to be going to somebody's house, we want you to say something to us, communicate what time you're leaving, what time you're coming home, kind of let us know what the details is, and there's a high five, fist bump, and you're out the door. But if the child just left and there was no what happened, it's kind of the same concept with Medicare Advantage plans. Medicare Advantage plans just want to be acknowledged and notified of what's coming up as far as a surgery. So typically, this is a very generic example, but the doctor will let the health plan know and say, hey, there's an outpatient or laparoscopic knee surgery being done. Here's the code. Here's the reason for it. And we've gone through the proper procedures. Now, the only time the authorization is going to get kicked back if the doctor is trying to jump 5 steps and just have a surgery done. And they're like, hey, have you tried PT? No, we're not going to do PT. We're going to do surgery. Well, the process is do PT first for so many visits, see where this person is, if they're improving and progressing through PT, do additional PT, and heal the knee correctly through physical therapy. If they're not progressing, then the next steps would be surgery. So the health plan is actually trying to save the client time and energy and honestly money, and not just jumping over from PT to surgery. So the Medicare Advantage plans, if you know that and understand that, then you're not getting upset because you're like, hey, I need surgery done, and they're asking me to do physical therapy first. The doctor should be educating you on the steps. The doctor should be taking responsibility of understanding continuity of care. And if the doctor is good, they're going to be saying, let's start doing the baby steps first and then do the surgery if we need it. A doctor should not ever just push you towards surgery unless it's a catastrophic situation and surgery is the only outcome that will solve the problem that you're facing. So there should be steps before. The Medicare Advantage plans are going to be there to catch that and kind of manage over with the doctor your health. Original Medicare is beginning to pick up on that, beginning to say, hey, there should be a process. But honestly, with Original Medicare, the doctor can say that the surgery needs to be done and it can be approved and the surgery is done. And the sadness of that is there is no level of accountability with Medicare saying to the doctor, have you gone through PT? Has there been the structure of outcome measured first and then have the surgery? So for me, I would rather not be cut on. I'd rather go through physical therapy if it was my body. Medicare looks at that a little bit different than how Medicare Advantage plans do look at it. So last thing, seniors might miss out on the flexibility and potential broader coverage of original Medicare if they choose an Advantage plan based on a misconception. You just need to understand, how does the Medicare Advantage plan work, and these items that I just covered with you, and then how original Medicare works, and then really be able to say what's best for me. And then the last thing before we go into myth 2 in the second video is you need to ask questions, and a lot of times you don't know what questions to ask. And so this is where it comes back to trusting an agency or trusting someone that's going to guide you through this process the correct way. And our process is pretty simple. We collect information, we put that information into a software platform, and that software platform, based on the person's information, is going to tell us which plan is the better option for that person. Now, prior to that, we're going to educate them on the different health plan options and ask the questions that you probably don't even know to ask sometimes. And if your health is at risk, a lot of times you should be on Medicare supplement. If you're a healthy person and you're detached from going to the doctor a lot and you're like, hey, I just want to make sure I'm covered, and if I have to pay a little money out of pocket, it's fine, and I don't mind my doctors sending me to whatever specialist and going through the steps, and you're educated on that Medicare Advantage plan and how it works, Medicare Advantage plans can be a great plan option for a lot of people. About 50% of the population now enroll into Medicare Advantage plans. A large percentage of those people are happy with their plans, and there's always going to be problems. So I like to end with this: where there's people, there are problems. So health plans, Medicare are all dealing with people working for these health plans and for Medicare, and where there is people involved, there is going to be a problem at some given point. Someone drops the ball. You need guidance. You need a question answered. You have a problem without a solution. And that's where working with a licensed agency that specializes in Medicare health plan is really important for you to have somebody that's educated and knows what they're doing to walk you through the steps. Guys, the second myth we're going to be talking about is Medicare cover everything. I'll be back with you shortly.